A strike is looming within the nursing fraternity if the government does not heed to their demands in 7 days' time.
Immediate registration of the Kenya National Union of Nurses. Immediate registration of the Kenya National Union of Nurses. That is issue number one that the government must address. Number two, employment of all nurses on contracts arrangements. These contracts arrangements include economic stimulus program, Danita, capacity building, and all other contracts that these nurses deserve to be employed with immediate effect. And the demand of the union is to be employed from 1st July 2012. Commitment by the government to improve medical equipment and supplies to all public health facilities. The government must commit that it will improve medical supply to all public health facilities. Redesignation and promotion of all deserving nurses. This has to be done immediately. Appointment of the Director of Nursing Services and filling of vacant positions within the nursing establishment. Stoppage, immediate stoppage of illegal union deductions that are being effected by the government to the benefit of the Union of Kenya Civil Servants.
The union leaders are outraged by what they term as a ploy by the Union of Kenya Civil Servants to frustrate their efforts in registering the Kenya National Union of Nurses during a meeting held last week with the Public Service Permanent Secretary.
The Civil Servants Union said, if you want us to support National Hospital Insurance Fund, do not register Nurses Union. This took place on Tuesday this week in the Ministry of State for Public Service, and it was chaired by the PS, Minister of Public Service, Mr. Ndambuki.
The nurses have now said that they will not relent in their quest to have their demands met, stating that the National Labour Board has been compromised to frustrate their efforts.
We are saying as nurses, we shall fight for our rights. We are saying as nurses, even how much can be used, how much money can be given to the National Labour Board of Kenya, that the National Labour Board of Kenya can be bought by a few shillings to deny us our rights. We are saying even billions of shillings will be bought everywhere, but the nurses, our bleeding hearts, will stop at nothing until we deliver the union for the nurses and until the rights of the nurses are fulfilled by the government.
Hatuwezi kuwa muuguzi anakaa miaka 10 haja promotiwa. Anajitorea pesa yake, anaenda kusoma, akirudi ako pale pale. Alafu watu wa Kenya wanauliza kwa nini muuguzi hana smile? Kwa nini huu muuguzi hanitibu vizuri? Huyo muuguzi ako peke yake. Ward iko na 70 people. Hata kama ni wewe ni nini nafanya?
They are also demanding full implementation of all approved allowances, including a uniform allowance of 5,000 shillings up from 833 shillings per month, non-practice allowance of 30,000 shillings per month, commuter allowance of 15,000 shillings per month, high-risk allowance of 20,000 shillings a month, and theatre allowance of 30,000 shillings per month, as well as call allowance of 30,000 shillings per month. The nurses have issued a 7-day ultimatum, after which they will down their tools, paralyzing hospital operations across the country. Nancy Njoki, GBS News.